Good afternoon. I am Dr. Sampada Dessai, Consultant Gynecologic Surgeon at PD Hinduja Hospital. So January is a Cervical Cancer Awareness Month. So we thought we would discuss about this cancer because this cancer is a major problem in our country. During this talk, if you have any questions, you can ask me at the end of the session and I'll be happy to answer them. So is this cancer really a problem in our country? The answer to this question is yes. It is the second most common cancer in women in India. It ranks only after the breast cancer and it accounts for about 20% of the cancers that occurs in women. In 2020, we had about 1,24,000 women who were diagnosed with this cancer. Another important thing is that out of this 1,23,000, we had also 77,000 deaths that occurred because of this cancer. So it is more than 50% of the patients who are diagnosed with this cancer will die of this cancers. This is very high mortality rate, or the chances of dying out of this cancer is very high if you compare to other cancers like breast cancer. Another important thing about this cancer is affecting our younger generation population. The peak age of this cancer is about 35 to 40 years. So it affects the reproductive age group people and also working women. And the most important thing is that this is one cancer among the few cancers that is completely preventable, but still we are not able to prevent it till today. So I'll be speaking more about prevention of these cancers. What can we do? What can every woman do to prevent this cancer? So first we will look at what is this cervical cancer. So if you look at the female reproductive tract, we have a womb or baby back and the birth canal. These two parts are connected together by this part called as cervix. This is the part that the doctor will see or the gynecologist see when they do an internal examination. They see for it and they feel for it. So any cancer arising from this part is called as cervical cancer. Now what causes this cancer? This cancer is caused by a virus called as human papilloma virus. This is one of the few cancers that is being caused by the virus, and this virus name is human papilloma virus. This virus is transmitted mainly through sexual activity. So to know more about human papilloma virus, we call it in short as a HPV virus also. There are many strains of this virus. More than 120 strains have been identified. Not all types of HPVs are capable of causing cancer. Out of these 120 types, there are about 14 kinds that are proven to be causing cancer. And this HPV virus, which can cause cancer, we call them as high-risk HPV virus or oncogenic HPV virus. This high-risk HPV virus, some of it are HPV 16, HPV 18, HPV 31, HPV 33, 45, 52 and 58. These are the main types that are capable of causing cancer. So which are these cancers? It does not only cause cervical cancers, but it causes other types of cancers like anogenital cancer or oropharyngeal cancers. Apart from this high-risk oncogenic HPV, there are low-risk oncogenic HPV which are responsible for the formation of warts. So today we will focus mainly on high-risk HPV. So how is it transmitted? As I have told you, this HPV infection is usually transmitted by sexual activity. If you see any woman who has become sexually active, the chances of this woman, almost 90% of the women after 2 to 3 years will get HPV positive. But most women, even if they are infected with high risk HPV virus, 90% of the women will clear this infection by its body's own immune mechanism. Only a few women will have this persistent HPV infection. What do we mean by persistent HPV infection is that HPV infection lasting more than 2 years. So it is these persistent HPV infections that leads to cellular changes within the cervix. They stay within that cervix, cross the cellular changes. It takes about 8 to 10 years for the persistent HPV infection, the HPV virus staying within the cervix to cause cellular changes. These are called as pre-invasive diseases of the cervix. That is a pre-cancerous stage. And from pre-cancerous stage to cancerous stage, it takes about another 8 to 10 years. So we have enough time. This diagram shows like once the woman is sexually active and they have a persistent HPV infection, to progress it into the precancerous stage, it takes about 8 to 10 years, and from precancer to cancer, it takes about another 10 years. So we have ample time during which we can take action and prevent this cancer. It is true that HPV virus is essential cause for development of cervical cancer. But there are certain risk factors that will increase one's chances of getting these persistent HPV infections. So what are these risk factors? So initiation of sexual activity at early age is one of the risk factors, like having intercourse before the age of 21 years or 18 years will increase the chances of having persistent HPV infection. Having many sexual partners or having the first childbirth at early age or having too many children also increases the risk of persistent HPV infection. Other things that will increase the chance of persistent HPV infections are smoking. Use of oral contraceptive pills for more than 5 years is also been implicated in increased risk of persistent HPV infection, and anything that decreases the body's immune capacity to clear off this virus. So what are these immunocompromised states? So having HIV infection or having chronic renal failure or any transplant patients who are on long-term steroids or having another cancers that will decrease body's immune mechanism and hence the capacity of the body to fight against this virus. So these are some of the risk factors that will increase your risk of having persistent HPV infection and hence cervical cancer. So what are the symptoms of this cervical cancer? How should a woman know they have got cancer? Unfortunately, in early stages, we do not have any symptoms, especially in the precancerous stage or very early cancerous stage. Women might not experience any symptom. Some of the subtle symptoms that might be present are abnormal vaginal bleeding, which may include bleeding after intercourse, that is called as postcoital bleeding, or bleeding in between periods, that is called as intermenstrual bleeding, or any bleeding that occurs after your periods have stopped, that is postmenopausal bleeding. It might present as abnormal vaginal discharge, which might or might not be foul smelling. Symptoms of advanced stage disease include development of leg pain, pelvic pain, difficulty in passing urine, bleeding from rectum or bladder. These are some of the symptoms that might present when one has cervical cancer. So how do we prevent this disease? There are 3 methods of preventing this disease, that is treat the cause, avoid the risk factors, and screen and treat the precancerous condition. Now coming to the first one, treat the cause. We now know that cervical cancer is caused by HPV virus. The best way is to prevent this virus infection from occurring. So what we have, like what we had for COVID, we have the vaccines available for HPV to fight against HPV virus also. These vaccines have been available in market for a very long time, but many of us don't know that such kind of vaccines exist. There are three vaccines that are available in the market. That is a bivalent vaccine that is called as Cervix, which cover against the main HPV viruses 16 and 18. Now this HPV virus 16 and 18 causes 70% of the cervical cancers. These are the main group of high risk HPV viruses that are causing this cancer. So all these three vaccines are included against these two type of viruses. So the second vaccine that is available is a quadrivalent vaccine that include 4 HPV subtypes, that is called as Gardasil. And the third vaccine that is been available is a Gardasil 9, which will cover much more strains of HPV viruses. All these three vaccines are now available in India, and they are recommended for the age group between the age of 9 to 26 years. In India, they are recommended only for girls. In Western country, they are recommended even for boys. Especially Gardasil 9 can be given also for boys. So who should take this vaccine and when you should be taking this vaccine? This vaccine is to be taken, is best effective when we take it prior to initiation of sexual activity, that is prior to exposure to this virus. So it is recommended between the age group of 9 to 15 years, preferably between 9 to 15 years. When you give it to the girls between the age group of 9 to 14 years, we give it in 2 doses because the immune response to this HPV vaccine is higher in this younger age group. When they are given after the age of 14 years, it is to be given in 3 doses. This vaccine has very mild side effects and they are safe, as well as their efficacy is proven till today. The second method of preventing cervical cancer is by screening. Again, cervical cancer is one such cancer that can be prevented by screening. This is because it has got a long natural history. We have that 20 years time gap between the initiation of a persistent HPV infection till the cellular changes that occur. There is something called as precancerous stage, and even from progressing from precancerous stage to the cancerous stage, we have a long time. So we can detect this cancer in a precancerous stage and can treat it completely. So we have some effective screening tests that can detect this HPV infection as well as the cellular changes that occur. Some of the main tests include Pep Test, Hpv Dna Test, and something called as visual inspection of cervix by using some solutions like acetic acid or Lugol's iodine. So what is Pep Test? Pep Test is a very simple test that can be done by any gynecologist, and it is during the routine visit this can be done. This is very painless test. It takes about 1 to 2 minutes. What is done during this test is that the cervix is seen and some cells are collected using a cotton swab, and these are then transferred onto the slide. These are then examined under microscope to see for any changes that have occurred and are treated accordingly. So who should undergo this test? All women who are sexually active and has become 21 years of age should start undergoing this test. This test is to be repeated once in 3 years, and this has to be continued up to the age of 65 years. What precautions you are supposed to take when you go for this Pep test? The precautions that are to be taken are you should not be having active bleeding at that time, so you should not be in your menses. You should not be having some active vaginal discharge. If it is there and a doctor sees it, they will treat it first and then take the Pep smear. And you should not be, you should refrain from sex for about 2 days prior to this test. Hpv Dna test is again a similarly collected sample, and what we look in this is we look for presence of viral DNA. Now this is more sensitive test and it is recommended above the age of 30 years, And if you do Pap smear test as well as Hpv DNA test and both the tests are negative, you can undergo the repeat screening test after 5 years. Now sometimes, especially in rural India or rural places, these technologies might not be available, and the very simple thing that can be done in this setting is visual inspection of the cervix by applying some solutions. And these are our own studies that were published that show that even visual inspection by acetic acid has shown to decrease the incidence of cervical cancer and death by cervical cancer in our country. Now, in Western population, these tests are mandatory for all women. In India, most of our women doesn't even know that such screening test exists, and it is ideally all women should be undergoing this test. For some women, it might not be technically possible to do this test every 3 yearly or 5 yearly. So whenever there is an opportunity, we should be doing this test. Even when you visit for any other cause to your gynecologist, request them to do this test. And if one test has to be done once in a lifetime, then it preferably should be a Hpv DNA test. This is again a paper from India only. We showed that even like screening once in a lifetime for a Hpv DNA has decreased the mortality. That is deaths are occurring due to this cancer. So this even the single screening test have detected some precancerous lesion which got effectively treated. So what should be the age if you are undergoing a single test? Will be preferred age will be somewhere like 35 to 35 years of age. So these are the screening guidelines that every woman once they are sexually active between 21 to 29 years, the preferred test is a Pap smear test once in 3 years. If Hpv DNA facility is available and if you are affording to do Hpv DNA after the 30 years of age, you can undergo both these tests together and the testing frequency can be again increased to 5 years. After 65 years, these tests can be done but are not recommended according to the guidelines. So in the nutshell, the prevention of cervical cancers include 3 things. One is vaccinating the eligible population, that is girls between the age group of 9 to 14 years. Though these vaccines are not included in our Indian routine vaccination schedule, you can ask the pediatrician. When you're following up with the pediatrician gives these vaccines, and in the older age group, these vaccines are given by the gynecologist or your gyne-oncologist. The second method of prevention is preventing the risk factors. We should be aware about the risk factors and try to avoid them as far as possible. And thirdly, screening. So whoever are eligible, I have told the eligibility criteria, should undergo a regular screening which can help to detect this cancer in early stages. So anything that is detected early has got very high cure rates. If something is detected in precancerous stage, like what we call as cervical intraepithelial neoplasia, they are 100% curable. In early stages, 90 to 92% of the time, we can cure them. Why that? I told you that the 77,000 deaths that occurred in India because of this cervical cancer. Why is this death rate very high? This is because we are diagnosing only 10 to 12% of our women are coming in early stages. Most of them, 80% of the patients are coming in advanced stages, either in stage 2 or 3 or 4. So the survival rate or the chances of dying from this cancer increases as the stage increases. Briefly, I will tell you what is the treatment of this cervical cancer. We divide it into two groups. First is early stage and a locally advanced stage. Early stage can be treated by surgery or chemoradiotherapy, and for locally advanced stage we treat it with chemoradiotherapy. So this is a different type of hysterectomy rather than a simple hysterectomy that is routinely done for the cervical cancer. And this surgery has to be done by our traditional open method, because there was one recent study that showed that if we do it by keyhole surgery or if we do it by robotic assisted or any laparoscopic surgery, the chances of cure decreases or the chances of disease coming back increases if we do them by this minimally invasive technique. So we routinely do this by open technique. The other method of treating this cancer is by radiotherapy. The radiotherapy includes two modalities, that is external radiotherapy, as well as this patient have to undergo a internal radiotherapy that we call as brachytherapy, and this is given along with chemotherapy. So I have told you this cancer occurs in the younger age groups. The peak incidence is seen somewhere between 35 to 40 years. This is one peak incidence, and the other peak incidence is after menopause, that is after 60 years of age. So many of our women now are delaying their pregnancies, and we find many patients who have not completed their family or not even started their family, and they are diagnosed with cervical cancers. So in this population, do you have options? Yes, the options does exist. Only thing, the patient has to be treated by a properly trained gynecologist. The selection criteria are stringent because we don't want the disease to be coming back. We do something called as conservative surgeries for these patients, but the disease has to be really small. It has to satisfy all our criteria for giving fertility, what we call as fertility sparing treatment for these patients, and these patients has to follow up on regular basis. What we do is we remove only the disease part of the cervix, or that canal is removed with adequate margins, and the upper uterus and the birth canal is then sutured together. The success rate is very high. The chances of second trimester losses are little higher in this group of patients whom we have given fertility sparing surgery. Fertility as outcomes are also good. So to conclude, this cervical cancer is a very much preventable disease. Screening helps in early detection of this cancer, and if this cancer is detected early, it can be cured completely. So what we should be aiming at is to vaccinate the eligible populations, screen all women, and be aware of these early symptoms and report them early, so this disease can be cured with high cure rates. Now if you have any queries, you can ask me. There are some of the queries that have come. So the first query is it compulsory to have cervical cancer vaccine? In Indian population, it is not made a compulsory to have cervical cancer vaccine, but it is recommended that if you can afford, these vaccines are little costlier. It costs around, a single dose cost around somewhere between 2000 to 4000. So if you are affording and if the facility is available, I think it is, though it is not compulsory, one should be preferring to take this HPV vaccine. The other question is, can 30-year-old female take cervical cancer vaccine too? Though the recommended guideline is up to 26 years, you can take it up to, it can be given to any age group, but the efficacy of it goes lower, especially once you are exposed to HPV virus. So it is individual decision to take this vaccine after the age of 26 years and once they are sexually active. Another question is, can cervical cancer spread? So this cancer does not spread by touch, or it is not a hereditary cancer, but I have told you how it develops. It develops by sexual HPV virus, which is transmitted by sexual activity.
So there are questions, doctor, in the chat section,
Yeah.
as well as Q&A sections. Request you to take them.
So there is a question, what are the side effects of vaccination? Side effects of vaccination are mild. It is like any other vaccines that you will get pain, might get little bit of fever. So these are very mild side effects associated with this vaccine. So all these three vaccine, what is the best vaccine for a girl who is 20-year-old is the question. So all three vaccines are shown to be efficacious, and you can opt for any of the vaccine. All three are equally good and equally safe. So post cancer surgery, can we take vaccine? If it is, I have not understood the question. Post what cancer? If it is same cervical cancer, I think you might be already treated and you are already infected with HPV virus. So it might not serve your purpose. So any other cancer, if you have, if the treatment is all over, then you can take this vaccine. What about women of age above 65? Are they safe? They are not safe. Actually, this cancer can be diagnosed at any age. It can occur above the age of 65 years. But only when they made a guideline, they said there is no need of screening this woman above the age of 65 if the previous smear tests are normal. This is because of the natural history of the disease, that it takes, if you are not infected till the age of 65, after you get infected after the age of 65 and then takes 20 years for the development to cancer, you will be almost 85. So that might have been not a cost effective strategies for those governments to implement the screening. That's why they have said do not screen above the age of 65. But it is not that this cancer can occur. Cancer does not know the age, whether you are 65-year-old or whether you are 70-year-old. So it can occur at any time. So what is the gap between three doses of vaccination? The gap between the first, if you are giving two doses, the gap should be at least 5 months apart. If you are giving three doses, it is 0, 8 weeks, and the third dose after 6 months.
There are few questions in the Q&A, doctor.
Yeah. So somebody has asked a question. My daughter is 12-year-old, so should I give her the vaccine and when? She is 12-year-old, so she becomes eligible for the vaccine, and you can meet your pediatrician and they can give you that vaccine. At the age of 37 to 38 year, what test should you recommend, and what are the symptoms that are easily identified? Symptoms, so I have covered in my presentation. Anything abnormal vaginal bleeding or abnormal vaginal discharge, you should be reporting to the doctor. 37 to 38 years, you can do both Hpv DNA test as well as a pap smear test. They can be co-tested, they can be tested together, and if normal, you can repeat this testing after 5 years. Any more queries?
Any more questions, then you can ask the doctor, or else madam can end the session.
So no more queries. Can I end the session?
I think we can do that.
Okay.
Thank you. Thanks a lot.
Thank you.